Welcome to Healthy Living. I'm Lori Johnson. Thanks for joining us today. Our topic is how to have a healthy pregnancy and delivery. And my guest is Dr. Alan Lindemann, an obstetrician with over 40 years of experience who has delivered over 6,000 babies and has a maternal mortality rate of 0. Dr. Lindemann, great to see you. Thank you so much for being here today, and congratulations on your success rate.
Thank you, Lori. I really appreciate being here today.
So you are really in the business and trying to spread the word to mothers and to pregnant women and prospective mothers about how to have a healthy pregnancy and delivery experience. And you have a lot of tips for people. What is the most important thing women need to know?
If you look at, the first thing we need to ask is why? Why are these topics important? And if you look at countries like Norway and Sweden, they have a maternal mortality rate of 2 or 3 per 100,000. And we have now, we're up to 75 per 100,000. So then what do women need to know about pregnancy? Certainly, women need to start taking the reins of this horse and directing your own pregnancy. So the most important thing, I think, is to remember that behavioral health is a really big problem today, and that includes postpartum depression, suicide, homicide, and drug overdose. So how do we reduce those things? I did it for many years. I did not have any patients who've been permanently injured by postpartum depression. But I think the most important thing is to have as many visits as you need to have to your obstetrician or your midwife or whoever is taking care of you. And that includes for the prenatal course as well as postpartum. One of the problems we have in this country is that postpartum ends at 6 weeks. Whereas it ought to end at a year or as long as and many visits as necessary. And one of the things that I did to try to avoid postpartum depression is I invited the entire family. For example, mom was welcome, dad was welcome, and as many babies, many children as they have, they were all welcome so they could hit the ground running. They knew that there was a little person inside there, and they began bonding before delivery.
I'm really glad you brought up this issue of postpartum depression. People don't talk about it enough. It is in many ways a taboo subject and misunderstood. I remember many years ago when I was pregnant with my first child, I was reading the book, What to Expect When You're Expecting, and there was a chapter on postpartum depression, and I skipped over it because I thought, wait, I'm excited about my baby. I want my child. I can't wait. I'm not going to be depressed. And really, it's not about that. Sometimes it's a hormonal thing, and women don't realize that it can happen to anybody, regardless of the circumstances of your life.
Yes, it's very important. And, if you look at now the death from suicide, homicide, and drug overdose, those are all functions of postpartum depression. And the CDC says that all of those deaths are preventable. And the problem that we have is that, again, according to the CDC, 82% of those people have been in mental health care or are in mental health care in the last year. So even if we identify them, we're not doing a very good job of treating them. And I think that postpartum depression is actually manageable and preventable. You're right, hormones play a part, and I can't discount that. But also, it's what should you expect when you go home? How much help can you get from your husband? And it's practical things like washing the dishes, preparing the meals, washing the breast pump. But the two of you, mom and dad, are in this together. Dad can get up with the baby at night, at least sometimes. So this is something that I always like to see that we took care of before the delivery. So it wasn't a surprise to the parents when they went home.
So new mothers or expectant mothers really need to look into this and understand what they might be experiencing and realize that it can happen to them. I remember the feeling of the walls closing in. It's nothing I'd ever experienced before, but I was just up all the time, alone with my child so much of the time. But if you could explain, though, the difference between postpartum depression and postpartum psychosis, where that is a little bit even more serious, right? Postpartum
Oh,
psychosis.
postpartum psychosis is extremely dangerous. And the way ACOG, that is the American College of OBGYN, defines this is it's a time limit. In other words, every woman apparently has some baby blues, which lasts 3 to 7 days. But anything that lasts longer than that is considered the beginning of postpartum depression. And then postpartum depression goes up till about 6 months. And after that, if you still have it, then you run the risk of psychosis. And psychosis is very dangerous because you can have voices telling you to kill your children. And that's the biggest risk, is infanticide.
Yes, and we've tragically seen this happen before with women. So if you are in the life, if you are a partner, a husband, the mother of a woman who has had a child, how can you be on the lookout for signs of postpartum psychosis, which can be, as you say, deadly?
Well, recently there has been this patient on NPR, and she's really a classic example. A nurse, and of course, nurses think that they have to take care of everything all the time. No, they have to be perfect. 32 years old. She had a 5-year-old, a 3-year-old, and a 7-month-old. And she was getting up at 1 o'clock, 2 o'clock, and 3 o'clock with the baby at 7 months. In amongst all of this, she had sought mental health care from a clinic. She had also sought mental health care from a hospital, and she was actually hospitalized from January 1st to January 5th. But she strangled her children on January 25th. She had explained to her husband and to the care providers that she had thoughts of killing her children. So if you can get things together enough, that is, if the patient can, to say, I have thoughts of killing my children, those thoughts need to be taken extremely seriously.
Absolutely. So people in the orbit of these moms need to really be paying attention. And the big red flags are when you're hearing voices, I suppose, right?
Absolutely. That's really one of the signs of psychosis. You're right.
Hmm. Hmm. Well, this is a very heavy subject, but definitely one we need to discuss. And there are a lot of taboos because we know that, moms are always supposed to be perfect and, in good mental health and happy that they have a child. And sometimes it just doesn't work out that way. And so they need so much support. We're going to take a quick break and be right back with Dr. Allen, who's going to talk about other things we need to know to have a healthy pregnancy and child delivery experience. Stay with us.
Your news channel, your shows, the stories you care about. Anytime you want, anywhere you want. Download the CBN News app today.
Welcome back to Healthy Living, and we are continuing our discussion with Dr. Alan Lindemann, an obstetrician who has delivered over 6,000 babies and has a lot of advice about how to have a healthy pregnancy and delivery. So, Dr. Allen, we had a very serious and wonderful discussion in the last segment about postpartum depression and postpartum psychosis. Let's back up a little to way before the baby comes and choosing an obstetrician. How does a person go about doing that for the best outcome?
Well, one of the things I think we're going to be seeing in the future, and we're seeing it already, is patient autonomy. In other words, choice. There are a lot of things that happen to pregnant moms that take choice away. For example, that starts with your insurance company, and it tells you who you can see, where you can go, where you have to deliver, how many visits you get, how long they last, how many ultrasounds you get. So these are things to talk to your doctor about. The other things would be, am I going to see you for my all of my visits? Am I going to see you for some of my visits? What is my chance of having you be my delivering doctor? What do you think about postpartum? And then you get into labor. You know what mom's like in labor? It's warm, dark, quiet. Those are really important things. If you get things like light and noise and pain, like IV sites and a lot of running around and exams, that can actually turn off your labor or slow it down. So you should ask your doctor what they think about labor and delivery. Also, who's going to be at their delivery.
I see. So some of the choices there could be like when you talk about who's going to be at the delivery, are you talking about things like nurses or doulas? What type of medical professionals will be there?
You're absolutely right. All of the above. Is my husband or my partner welcome? Can I have a doula? Are you going to be at my delivery, or do I expect somebody else? And if I expect somebody else, who might the somebody else be? Can I see them during the prenatal course so it's not a total surprise when I get to labor and delivery?
So we mentioned this term doula. A lot of our viewers might be like, a doula? What's that? It's kind of a new thing. We didn't have them, 25 years ago or more when I had my children. What are your thoughts about doulas and midwives? What are the differences?
Well, I have been working with midwives since 1975, which is when I did my first delivery. And so I grew up with midwives, and there are two varieties of midwives. There's a certified midwife, which works in the clinic, or who works in the clinic and does deliveries in the hospital. And then there's the lay midwife, who probably doesn't have a lot of formal education. I welcomed all midwives because I think that serves the public interest the best. If I had a lay midwife with a risky patient, they came into the hospital and acted as a doula. Now, a doula does not deliver babies. They don't see moms for prenatal care, but they do get to know moms and they help moms. They are soothing. They also represent moms in labor and delivery. But of course, if your husband comes in, to your prenatal visits, he can also help you with labor and delivery. So the doula is there to help,
All right.
intellectually, emotionally.
I've heard of actually midwives and doulas delivering babies in the home, not going to the hospital. What's your thought about that?
Well, we had a lot of lay midwives where I worked in Fargo and in various other places in North Dakota. I don't have anything against them. I do know that in Minnesota, lay midwives were licensed so that the medical board could have some control over them. But for the most part, I do think that they do a good job. They care about what they do. And I knew most of them personally, so I could endorse them. I mean, I could feel comfortable with what they were doing with their patients.
So you're okay with people having home births?
I think that home births are something that we will probably be seeing more of because of patient autonomy. And that's one of the things that is bothering more and more women now, is that they feel that they lose their rights in many ways when they have a hospital birth. So an at-home birth is an option. Even the American College of OBGYN says that if you really have to have a home birth, it should be within 15 minutes of a hospital. Mm-hmm. And it should be on the ground floor, so you don't have to be trying to carry somebody up and down steps.
Right. That's a great little addendum there in case something does go wrong. You're close to the hospital. All right. We're going to take another break and be right back with Dr. Alan Lindemann, obstetrician, who's discussing ways to have a healthy pregnancy and childbirth experience. Stay with us. Welcome back, and we're talking about how to have a healthy pregnancy and delivery with obstetrician Alan Lindemann. Dr. Alan, there are so many things during pregnancy that we need to watch out for. It seems like high blood pressure ranks way up there. Is that right?
Yes, I've been watching blood pressure, like I said, since 1975, so it's not anything new to me. It is surprising, when I hear people say things like it's mysterious and it's surprising. And I don't think it's either one of those things. I have never seen blood pressure come up suddenly in a pregnancy. I think sometimes it seems to be sudden if we're not watching for the clues. And I think one of the big clues is that blood pressure can go up just a little bit for a short time. In the past, when I saw these things happen, I would send them to the hospital. The nurses would then check 10 times and record the lowest blood pressure and say everything is fine. But I began to realize that what was important, it wasn't the lowest blood pressure that they could get. It was the highest blood pressure. So all of these patients who had high blood pressure, ask them to get blood pressure cuffs at home, and the medium price cuff is the best cuff. The high price cuff has unnecessary equipment on it, and the lowest price probably isn't the best quality, but a medium price cuff, if their pressure went up, say 10 points above their systolic or the diastolic, I asked them to call me. I'd also see them more often. And of course, I asked them to monitor their baby's movements at home. And I have to tell you this, naturally, I didn't have any mom who stroked out. And I didn't even have a mother who had eclampsia. Now, eclampsia is when your blood pressure, when your preeclampsia causes a seizure. And that can be difficult to manage. It is very risky for mothers and babies. But again, I think by watching blood pressure carefully and managing at home, we didn't have any serious complications for anybody.
You talked about preeclampsia and the high blood pressure, and this can be fatal. And this is actually one of the main causes of maternal mortality. Who's at most risk for having high blood pressure issues, preeclampsia?
Unfortunately, right now, Afro-American women have the highest risk. But again, there is a new program now where they're doing something that's actually quite old, which is they're sending their patients home with blood pressure cuffs. And these are fancy cuffs. So my patients always took their own pressures and called me. But these cuffs will tell the nurse exactly what the blood pressure was so that the patient doesn't even have to call the nurse. I think that's unnecessarily complicated because it's expensive. And 99% of patients, if you ask them and tell them and teach them about monitoring their blood pressure and why they're monitoring their blood pressure, they do a very good job of it.
And in addition to watching your blood pressure, which seems to be arguably the most important thing, what else is so critically important when you're pregnant? We think about things like taking your prenatal vitamins or, not getting an infection. We know that first trimester can be very critical because of the baby's development. Can you comment about some other key things that women need to know about taking care of themselves during pregnancy?
Yes, I think one of the most important things after blood pressure would be eating. And eating, it sounds like it should be simple, but it can be really complicated. We try to get moms to gain somewhere between 2 and 3 pounds a month. And in order to do that, you have to eat several small meals a day. I ask my patients to, especially if they have some trouble with nausea, to have some snack beside the bed that they could eat in the morning, like half an apple, some juice, some crackers, a granola bar, and then to not move. Let it set for 10 or 15 minutes get out of bed, and then have a bigger breakfast. And the bigger breakfast should contain a balanced diet. For example, there should be protein and fat, like something as simple as an egg. One of the problems that pregnant women have is that they get nauseated when they smell food cooking.
Mm-hmm.
So you can have a hard-boiled egg. You don't have to worry about the smell of cooking that. The kind of breakfast that you shouldn't eat in pregnancy would be what most people do eat, and that's cold cereal, skim milk, orange juice, and a piece of toast. If you really want to eat that, then have some protein and fat with it. Like I said, the egg or cheese, cottage cheese, and some real fruit like an apple or an orange or a pear instead of fruit juice.
All right, fantastic advice. We're going to take one final break and be right back with Dr. Alan Lindemann talking about healthy pregnancy and delivery. Stay with us. Continuing our discussion now about how to have a healthy pregnancy and delivery with Dr. Alan Lindemann. Dr. Lindemann, unfortunately, we're almost out of time. Can you tell our viewers where they can get more information about you?
Well, you can go to lindemannmd.com, and our new book, Pregnancy Your Way, is going to the final editor today. So that should be out soon, and it would be available at the website Lindemann MD.
You know, you were talking about so many things that women need to keep in mind when they're pregnant. It sounds like that the most important thing is also to make sure that they have that they have medical care. Are there a lot of women who don't seek appropriate medical care when they're pregnant?
Well, I think a lot of them try to seek appropriate medical care, but many women, they're socioeconomically deprived. They can't even get time off of work to get to a doctor's appointment. So there's many things we need to look at when it comes to prenatal care and getting the right amount of visits.
All right. Well, once again, Dr. Lindemann, thank you so much for your time and your expertise. We look forward to the book, Pregnancy Your Way. We appreciate you so much. Thank you.
Thank you so much. I appreciate it.
And thanks to you for tuning in to this edition of Healthy Living. I'm Lori Johnson, and we'll see you again next week.